To talk about the fetal circulation, there are three main shunts that are they have major effects on this circulation. So basically, we're going to follow these lines. Okay, so what we have here is that the blood is in the umbilical vein has a partial pressure of closely to 30 millimeter G, and it's kind of close to 80% saturated with O2. So the 80% saturation of with O2 is still less than normal adult person, but for the child or for the fetus actually, it's okay, it's normal. So basically, it's the umbilical vein, as it says here, that it brings the blood, the oxygenated blood, with its partial pressure of 30 and its O2 saturation of 80%, brings it from the mom to the fetus. So this is the placenta, and this is the red vessel that is collecting blood from the placenta and going upwards to the baby's heart. That is called the umbilical vein. Within the fetus, it's called umbilical vein. So this umbilical vein actually ends up attaching with the inferior vena cava of the baby. This is the inferior vena cava of the baby. So it does this through a shunt called ductus arteriosus. So it's an opening between the umbilical vein coming from the placenta with the inferior vena cava taking blood back to the heart. So by doing this, as we see here, is going through this way, so it's just ignoring the whole portal circulation. So it just goes directly to the heart through the inferior vena cava, and that what it says in step one. That is, blood entering fetus through the umbilical vein is conducted via ductus venosus into the inferior vena cava, bypassing hepatic circulation. That's how it's just avoiding the hepatic circulation. And then it goes into two that says most of the highly oxygenated blood reaching the heart via the inferior vena cava is directed through the foraminal valley into the left atrium. So most of the blood coming here through this inferior vena cava, this is the blood, just goes into the right atrium, but most of it, the majority of it, does not go to the right ventricle. Only a small portion goes to the right ventricle, but the majority of it just goes through the foramen ovale. This is the opening that is called the foramen ovale. So that blood comes through it to the right atrium. And of course, from the right atrium, it goes just normally to the left ventricle. And then from the left ventricle, right here to the aorta. And from the aorta, it should go to the systemic circulation, whether it's the head and whether it's the lower limbs, but it just goes normally from there. So that's the second shunt, that is the ductus arteriosus, that takes blood from the right atrium directly into the left atrium, and then it goes normally from that. So there is the other shunt here is just mentioned in step 3, that is deoxygenated blood from the superior vena cava passes through the right atrium, right ventricle, main pulmonary artery, and then the ductus arteriosus, and then descending aorta. Shunt is due to high fetal pulmonary artery resistance. So now let's talk about the blood coming. Okay, let's just delete all of this. Okay, so now the blood coming from the superior vena cava, that is normal, from like the upper head and neck, goes into the superior vena cava, and as it's expected normally to go into the right atrium, and then it would just keep going down like this goes into the pulmonary trunk in order to be oxygenated. That's the main goal. So it goes on into the main pulmonary duct. It should go into the right and left vessels in order to reach the lungs, right? But that's a weird lung. But the problem here is that this is a fetus. So he's not born yet. So there is no respiration. He doesn't not take breath. So the lungs are filled with fluid rather than O2. So if it's only fluid, then as we can tell that there is an increased resistance in the lungs. So basically the lungs have very high resistance, so the blood is unable to go like directly to it because of its high resistance of the lungs. So the only outlet that he has, the blood has, is to actually go into the aorta through a shunt in the fetal life that should be closed after birth, and that is called the ductus arteriosus. So it's the shunt between the main pulmonary artery into the aorta. That is all before birth. So that is the ductus arteriosus. At birth, what happens at birth is that the infant takes a breath, starts breathing, so that reduces the resistance in the pulmonary vasculature. So basically, these lungs will contain now O2 instead of fluid. So now it becomes O2 due to breathtaking baby. So their resistance that was high is just going down now. Okay, because it's a newborn now, not a fetus anymore. So they don't. So the lungs don't have higher resistance anymore, which means the blood coming from the pulmonary artery is able to go through the lungs and get oxygenated in the adult lungs. So at birth, the infant takes a breath, reduces the resistance in pulmonary vasculature, which increases the left atrial pressure versus the right atrial pressure. So the foramen ovale closes. Now it is called the fossa ovalis. Increase in the O2 from respiration and decrease in the prostaglandins from from placental separation would lead to the closure of ductus arteriosus. So basically, there is higher concentration of O2 due to breathing, and also after birth the placenta is gone, so the source of the prostaglandin is also gone. Those two reasons, the loss of or the reduction of the prostaglandins from just the respiration of the placenta, and also the increase in O2 due respiration, they both would cause this foramen ovale to close, and it just becomes a full nice septum, but with a small remnant or something to remind us of the opening that was here, and it is now called the fossa ovalis. So, but it's basically closed. This is just what stays of it, or the small remnant. It's a small indentation or depression in the atrial wall that would say that here was the opening between the two atria, and it was the foramen ovale. So, for some medications like NSAIDs, that like indomethacin or ibuprofen or acetaminophen can help close the patent ductus arteriosus, which is, as we said, it's this one, patent ductus arteriosus. So they can help us close it. If it closes, it's a duct, so if it closes, then it would end up being as a ligament, just a ligament. So if it closes, it would be called ligamentum arteriosum, and that is a remnant of ductus arteriosus. So in order to remember it, indomethacin helps end the PDA, while prostaglandins and like E1 and E2 would keep the PDA open. And this is something that we may need because in some conditions, for example, like transpositioning of great arteries, we will need that PDA to be still open. I mean, we will need that connection to stay over here in order to be communicating with the pulmonary trunk and the aorta to keep the baby alive. So for such conditions, for example, we would need to give prostaglandins just to keep it open and fight for having it open. So we have two images here. Probably this is the placenta, ductus arteriosus going upward. It's basically the same thing. So here's a simpler explanation that foramen ovale, it closes, leaving a small depression called the fossa ovalis. This isolates deoxygenated and oxygenated blood from within the heart, and the ductus arteriosus constricts, allowing blood leaving the right ventricle to travel to the lungs via the pulmonary arteries. So this is for the fetal circulation, while the and an important information here as well is that the umbilical arteries this time have low O2. So umbilical arteries are just, these are the umbilical arteries. They are the arteries going back to the, this is their direction, going back to the placenta, and they have low O2 because the body has, the baby or the fetus has used all of that O2 in his body. So now for fetal postnatal derivatives, we have the ductus arteriosus. As we said, it ends up being the ligamentum arteriosum. So it's a duct, so expected for a duct to be just a ligamentum. Okay, ductus arteriosus, ligamentum arteriosum, and that happens near the left recurrent laryngeal nerve. Okay, so the recurrent laryngeal nerve would go somewhere around here. Anyway, but it goes around here. For the ductus venosus, it's this one. It ends up being the ligamentum venosum. For foramen ovale, ends up being the fossa ovalis. For allantois and urachus, they end up being median umbilical ligaments in an infant, in a newborn. And it says that urachus is part of allantois between the bladder and umbilicus. So basically, the urachus here is a fibrous remnant of the allantois. It is a canal that drains the urinary bladder of the fetus that joins and runs within the umbilical cord. So it just, the urachus is the fibrous continuation, or actually remnant of the allantois, and it was supposed to drain the urinary bladder of the fetus into the umbilical cord going back to the mother. So allantois and urachus ends up urachus, which ends up basically median umbilical ligament. So for the umbilical arteries, these are the arteries here coming to the mother, back to the mother. They end up being medial umbilical ligaments. And for umbilical vein, it ends up being the ligamentum teres hepatis. Ligamentum teres hepatis, also called round ligament, and it is contained in the falciform ligaments of the liver. So umbilical vein ends up being ligamentum teres hepatis, and that is also called round ligament. It is contained in the falciform ligament. So this is the umbilical cord, just a cross-section of the umbilical cord. Both of these are the umbilical arteries coming from the mother, from the baby to the mother, and they are blue because they have low O2. But for the umbilical vein, it's coming from the mother to the child, to the fetus, so it has high O2. That's why it's colored red. And this is the